Greetings from Citizen Health and the Team Academy IAPSME Connect. And today, in the series of People's Health It Matters, we have my very favorite Dr. Deepthi R, who is Associate Professor in Department of Community Medicine, ESIC Medical College, Bangalore. A very warm welcome to you, ma'am, on behalf of all the audience.
Thank you so much, Ritu. It's always a pleasure being associated with you, and especially Citizen Health of IAPSM, which reaches every house of this country. Thank you so much for having me here.
Thank you, ma'am. And today we are going to talk on a very serious topic. Although ma'am has a very smiling face, but still we are going to talk on a very serious topic, that is developmental disorder. My question will be that what is developmental disorders, ma'am?
Developmental delay is today's topic. Like you said, it is serious, but it is not taken so seriously when it comes to the policy. Uh, Sometimes in India, especially, we confuse growth to development. Like if the child is having proper height, weight for the age, we say the child is developed well or the child is not developed. But no, we have to differentiate growth and development. Growth is the physical growth of the body, how a child improves its weight and height as the day goes. Development is lot more than that. It takes care of how the child develops some skills which is correct for that age. So when a child is growing, like at 3 months, the child has to smile, look at the mother and smile. The child's neck has to be, it should not fall off, it should stand still. So these are few things which we have to observe, and it's a progressive thing. At one point, we cannot just say, okay, the child has developmental delay. We need to keep checking, and then only we can say that the child is having developmental disorder or developmental delay.
Okay, sorry, I mispronounced developmental disorder. It is development delay, and as you have explained, but the second question comes in my mind, that what causes this developmental delay?
Many a times we don't know what is the cause, but also there are times when we know what the cause is. Some children, as soon as they're born, we know that they have some problem, like it may be Down syndrome or Klinefelter syndrome. They may be born with some genetic disorder. Okay, so those things will cause developmental delay. Other than those things, there are few things which we can note down whether the mother underwent during her pregnancy or the child faced during the delivery or following the delivery when the child is growing, which can lead to developmental delay. For example, if a mother is anemic, like if you take our Indian women, okay, 50% of our women in reproductive age group are anemic. And especially when you take women who are pregnant, okay, almost 70 to 80% of our pregnant mothers will be anemic. Okay, then nutrition wise, yes, our mothers are having less nutrition, especially when we speak about those 65% of the women who live in rural area and also the women who live in slums. And like when the child is born, if the child didn't cry immediately after the childbirth, or the child is having low birth weight, or the child is born before the time, like before like 36 to 42 weeks, it's okay. But if the child is born much earlier, or mother had some fever or some problem, she has taken some drugs which is not supposed to take during pregnancy, these things can have an effect on the child's development. And also, very importantly, once the child is born, the child should have proper nutrition. The child should not have anemia, and there should be a conducive environment in the house, in the sense the child should be stimulated. Like many a times, what, like even we are working parents, many times rural areas, the mother will go and the elder sister will be taking care of the child. She wouldn't know how to take care of the child. There is no actual proper stimulation for the child. These are various reasons why we can observe, or we can call, these are all the risk factors because of which a child can have developmental delay. There is some amount of factor where you can't pinpoint that this is the reason which is led to the developmental delay.
Okay, so what is the need? Why do we need to know about this developmental delay?
That's a very apt question. See, if you take the entire world, the World Health Organization says 200 million children are having developmental delay. I mean, look at the number, 200 million children in the world are suffering with developmental delay. And we have a program called as Rashtriya Bala Swasthya Karikrama. In the program itself, they say that 10% of the Indian children may undergo or may have developmental delay. Okay, which amounts to, like, it may not look like a priority, but once the child grows and becomes an adult, 20% of the productivity of the entire adult population of a country or the world is impacted. So we can think what is the impact, not just physically, but also economically. And a very important thing is, if you can identify this developmental delay early, it is like a wonder. Because when we look at the growth of a person, we see that various types of growth happens at various periods of life. So when we look at this development of a child, that is the brain, in brain it functions well because between two neurons there is synapses happening. Okay, so that's what stimulate and a child, or we learn well. Okay, so that is happening maximum in the first 3 years of life. Okay, so if we can identify it early, which can be so easily identified, and if we start to stimulate and start to intervene at that early age, then we can bring about some change, at least activities of daily living in a child where the developmental delay is really poor. And in a child which is like just going in for developmental delay, they can become all right and grow up like a child like you and me. Okay, so it can be identified and it can be treated early only if we can identify it. So these are the reasons why we need to really know about developmental delay. And one more thing I want to add, Ritu, here. In a country like India, uh, see, when a child is born, it's like an achievement. Like when my child is born, it means that I have achieved something. So the moment when parents find out that my child is not normal like other children, they go through various stages. The first stage is shock. I don't accept. I am so intelligent, or I am this. I don't want to accept that my child. So what I do, I go around shopping the doctors. Okay, I go to this because I just want to hear somebody saying, no, your child is fine. So they do that, they keep doing that. By then, this 3 years, this precious initial period is lost. By the time they really understand it, okay, this is the way it is, I need to do something, we lose that initial important phase where we can bring about really that important change in the child. So these are the reasons why every parent in this country need to know about developmental delay.
Great. And one scary question comes in my mind, that how do we know that our child has a developmental delay? And the second thing, that what is the minimum age when we can detect that, yes, my baby is having some problem? And the third, my third question is, sorry, asking all those questions in a single question, that if a baby is a premature, so will his activity will be automatically delayed, or it is something a problem?
Okay, so let me answer one by one. I would answer your second question first. How early? Okay, uh, actually, we can pick at 3 months, but it is not. We can pick, but you can't diagnose. You can't clear cut say, because we need to see the progression. So as early as 6 to 7 months, we can clearly say whether the child is having developmental delay. There are scales which can identify even at 2 months, even at 3 months. Okay, so now how do we identify developmental delay? So there are actually various types of developmental delay. Developmental delay can be, one, we say motor in the sense movement. Okay, so we know that at 3 months the child's neck shouldn't fall, it should stand stiff. Okay, so at 3 months that has to happen. At 5 months the child has to sit with some support. Okay, at 1 year the child has to at least crawl, and by at least 18 months the child should be able to walk without support. So for every uh, 3 months, from 3 months, there are certain milestones which is normal for that particular age group. Okay, so see, when you go to a government setup, they give something called as thai card. or MCH card. I don't know what is it called. Like in Karnataka, they call it Tai card. It is the MCH card, which is a booklet which has some 20 pages in it. So there it shows at what month, what development the child has to achieve. So just by looking at that, you know that this my child has to attain. And if that is not attained, then the mother should come to the doctor and say that my child is not able to do that. And in India, there is no concept of this well baby clinic like how it is in Western world. So a child is taken to a doctor either for immunization, or the child is taken when it is really sick. They try all this home dawai. When that doesn't work, then the child is taken. Most of the time it is like that, various reasons. Okay, so as such, a child is never assessed for a development routinely. Okay, so that's why it is. And who is the best person to identify developmental delay? Nobody better than a mother, because mother 100% attention will be on the child. Okay, so she will know. So she should know actually at what age what the child should attain. So once she know that these things are not attained, then she has to get the child immediately, or she has to report to the doctor or health worker that my child is not doing this. Is it okay? See, ideally, most children walk at 11 months, at 12 months. So, but they have given the time till 18 months. Even at 18 months, if the child is not walking, then that means the child is having some delay in the motor development. You know, there are 5 different domains or 5 different areas. So one is the motor, that is movement. Even in that, one is gross. Gross means like involving the legs, where you stand, where they crawl, where they walk, and such things. And next is the fine things. Fine thing is I'll pick up. If I put something in front of the child, at 3 to 5 months, the child will hold like this with the entire hand. Okay, then after some time, if you give something, the child will hold with 2 fingers. Then if you give a pen, it will scribble, then it will write something. So at particular age, the child is supposed to do a particular things. So if these things are delayed, that means there is a problem with the motor development. Second thing which we speak is speech and language. Okay, and many a times we know that a child cannot speak if they can't hear, because whatever we hear, we just recreate it. Okay, so it's very important to understand, when you make a sound, is the child turning? At 3 months, when you make a sound, the child should turn towards it. Okay, then around 5 to 7 months, it should be able to blabber, say baba, like that. Okay, and by 7 to 8 months, some one word, mama, papa, like that. Then by 1 year, it has to say some 1 or 2 words. Okay, and at 5 years, at 2 years, it should be able to speak a small sentence with meaning, and it should ask for something. Sometimes what child will do, if you want to say, give that, like that, it will show. It won't open its mouth. Okay, so if the child is doing that and not talking at all, then that means the child is having some problem with the speech and language development. And for that, very crucial is we need to screen for hearing. If the child is able to hear, able to turn at 3 months whenever the sound loud noise comes or a sound comes, that means the child hearing is normal. There is something else which needs to be evaluated. Now coming to the third thing which is important is vision. Up to 3 months, any child who is born will have a blurry vision. After that, the child may develop vision problems. How will you know? Like if you move something, some red or light in front of the child is supposed to turn its face towards whatever is moving. If the child is not moving at all, and sometimes we know our eyeballs coordinate. When we move, our eyeballs move accordingly. But when there is a vision problem, it will not move congruently. Okay, there will be movement of eyeballs which is incongruent, and there will be some visible squint which can be easily identified by parents, that the squint is really obvious. Okay, so these are the things which will point out that this child may be having some visual problems, and again they have to go to the doctor. Then fourth thing would be your social thing. So at 3 months, generally a child will smile at the mother. Okay, then at 5 months, when a mother, or 5 to 7 months, when somebody cuddles, the child will feel nice, especially mother. And at 7 months, if some stranger comes, it will be like scared, it doesn't want to go to them. Okay, and then later what will happen, if you play, like if I play peekaboo, the child will be interested, it want to really involve. And if you take something and hide, it wants to find out what you have hidden. The children should be like that. So that means there is no social or emotional developmental problem with the child. When the child is having some problems like autism or Down syndrome, they cannot have congruency with such things. So these are the things we check for this social and emotional developmental delay. And finally comes the cognition. Cognition is a child's intelligence. Okay, so at the age of 1 year, the child should be able to, when you say something, the child should be able to understand. And at the age of 2 years, the child should be able to do certain things which are like meaningful. Like if you show the brush, the child should know that this brush is to brush the teeth. Or if I show food, then the child should know it is to eat. So these are the things which determine the intelligence, or we call it as cognitive domain. So these are the 5 areas we look. Some children may have just one domain, some problem may be there depending upon what disease or what problem they are facing. But many children will have more than one condition. So if more than two or more domains, if it's affected, then it is called as global developmental delay. Okay, so for that, how we manage and how we take care of the child will be a little different than an individual thing. Okay, so these are so I would say there are charts. If we can share it, I will share it. You can upload it
Please, please.
in the screen. Yeah, so that the parents can download it and check whether the child's development is proper, appropriate. So earlier they identify, the child's brain is so wonderful. The moment you start stimulating and teaching the brain, even though if the child is Down syndrome, okay, the moment you start training, the child will pick it up. You can imagine a child of Down syndrome opening a restaurant, doing so many other things. It is such a relief for the child and also for the parents, because it's not just the child who is not having life. We should understand, whenever there is a child with developmental delay or disability, the whole family will be impacted. Okay, so this is how we identify developmental delay.
And my third question was, if the baby was premature, then
Got it. Yeah. If a child is premature, what we do is, like if the child is born at 36 weeks, but the child is supposed to be born at 38 to 40 weeks. So we will start checking after 4 weeks. We'll consider as the birth age. And from that point, we will check the development. We like at the child's 2 month, we will not check 2 months development. We will check child's 3 month development when that child is 4 months. So that's how we check in a premature child. So we give that time for the premature child to buck up and come to the normalcy.
okay. And what should a parent do once they come to know that the child is suffering from developmental delay? What should a parent should do? Where to go? Which doctor they need to be concerned? What is needed to be done?
Yeah, this is an important question, Ritu. See, many a times we have seen they being identified, and they take 2-3 times, and they feel the facilities are not great, and the parents will leave. Because in our country there are no facilities which is there at the grassroots level, like a PHC. You may have some centers at the, like, early intervention centers are there at the district level. But in cities, if they are living in city, then there are a lot of centers which can support them. If you're living in a rural area, still you can support. So once, like if you're in a rural area or in a slum, okay, then immediately the moment you find out the child is having, you can tell the Anganwadi teacher or the Asha worker, this is the problem. So there is a program called as Rashtriya Bala Swasthya Karikrama, in which we are supposed to report these developmental delay and disability. So they will report, okay, and they will guide those mothers to district early intervention centers. There are few places where in the CHCs and taluka hospitals also there are early intervention centers, so they can be referred there where there is a team. It's not just one person. There will be some 7 8 people like pediatrician, then a psychiatrist, psychologist, then speech therapist, occupational therapist, physiotherapist. So they work as a team, so they will support you. If you can, if you are affordable, if you're living in a urban area, then you can go to a pediatrician. The pediatrician will definitely guide you. There'll be a lot of non-governmental organizations and also private clinics which can support you in taking care of the child. But early intervention is the key. The earlier you start, the better is the outcome which you can see in those children. And this is something which will check our patience, which will check how persistent we are. We need to change the way we live. We need to accept it and adapt the way we live, and that will definitely bring in the change.
Very true, ma'am. Very interesting. Any last message to all those parents who go in a denial phase once they come to know that the child is having some problem, but they do not, as you have already said, that they don't want to accept this situation. So, any message to them?
No, I completely empathize with all the parents, because if I put myself in my shoe, I think even I go through such situations. But the final thing is they want the best for the child and for the family. That is the final dictum which all of them want. So keeping that in mind, if you want to go to some god, if you want to take alternative therapy, you can take. I'm not saying that is wrong, but along with that, there are proven interventions which will help the child. And I feel the child, and not just the child, yourself as parents shouldn't be denied of that, so that the child can have an activity of daily living. The child can have a social life which will definitely help the family and the child over a long term. So accept it fast and come to the uh, therapist or come to the pediatrician as soon as possible and seek treatment. Be persistent. It will definitely bring in a change. There are studies which are proven throughout the world that early intervention with this nutritional supplement and constant stimulation, the children have had much better development than compared to the children who did not have any of these things. So don't let your children not get these facilities and not have a complete life. Yeah.
Thank you so much, ma'am. Thank you so much for such a beautiful message, such an informational session.
Thank you
Thank
so
you, ma'am.
much, Ritu. It was such a pleasure, you people having me. And I want to thank IAPSM for giving me this opportunity, and especially you for having me. Thank you so much.